Welcome to Healthy Births, Happy Babies, where we share tips, tools, and stories grounded in natural childbirth and parenting principles, so that instead of feeling overwhelmed and confused during this exciting time in your life, you feel safe, supported, and empowered in your childbirth and parenting journey. And now, here's your host, Dr. J. Warren.
Hello and welcome to another episode of Healthy Births, Happy Babies. I am Dr. J. Warren. I'm the Family Wellness Chiropractor and the Wellness Care Coordinator here at the CAP Wellness Center. And today we have two guests for you today. It's a husband and wife team, the Warners, Dr. Stuart and Dr. Theresa Warner. They are absolute powerhouses in pediatric care, and they are going to share their passion for children's care, but then also some of their wisdom and their knowledge about what you can do to allow your child to live to their full health potential, whether they're your children already here and something you can do for their health right now, or if you are still expecting, something you can do as soon as they're born so that their bodies are functioning as optimally as possible and they can fulfill their full health potential. But before I bring them on, I want to take a moment to thank our sponsor, the CAP Wellness Center, who's making this podcast possible for you. The CAP Wellness Center in Encinitas, California, has assembled an incredible team of fully certified holistic healthcare professionals that offer the very best in prenatal, postpartum, and pediatric wellness services. We offer acupuncture, chiropractic, massage, yoga, lactation support services, and a wide variety of birth education classes to ensure that you are fully able to experience the power of birth. And now let me introduce the Warners to you, and then we'll switch over to our conversation. Dr. Stuart and Dr. Theresa Warner are a husband and wife chiropractic team who have been in private practice in Point Pleasant, New Jersey since 1992, where 75% of their patients are children under the age of 10. Guided by their passion for helping children achieve their full God-given potential, in almost every instance, the child is the first patient in the family to receive care in their practice. In 1995, the pair founded the celebrity and government-endorsed Kids Day International events, in which more than 5 million children have been screened for subluxation. The Doctors Warner have also founded Wellness Moms America, a chiropractic-led monthly meeting that brings together like-minded mothers to teach them how to live the chiropractic wellness lifestyle. The Warners are passionate about teaching children and love visiting schools each year to share the chiropractic message and teach kids about the detriments of subluxation and how to keep their spines and nervous system healthy. The Warners are also widely sought-after speakers and speak nationally and internationally on the topics of pediatrics and pregnancy. Yet despite all of these many accolades, the Warners' greatest achievements by far are their 3 beautiful children, Sydney, Skylar, and Alexis. All 3 children were adjusted within 5 minutes of being born, practiced extended breastfeeding and co-sleeping, and have been raised in the chiropractic lifestyle. I am very excited to have the Warners on the podcast today, so let's switch right over to our conversation now. Dr. Stu, Dr. Terry, welcome to the podcast.
Thank you. Great to be here.
Glad to be here.
Great. Well, as I said at the beginning of the show here, I read your bio, and you two have done so much for the profession with chiropractic pediatrics, but then also so much for the community and for the families that are there. The bio that I read, I really had to shorten it down. You guys have done so much. So if you could, for our listeners that might not be familiar with you, I'm certainly familiar with you. I've been following you my entire career. I've learned so much from you. But tell our listeners about how you got interested in, one, maybe chiropractic, but then also taking care of all the little ones.
Okay, well, I'll tell you that for myself, my admiration for chiropractors working with kids started when I was a kid. I was lucky enough when my parents had moved when I was a child. We moved in next door to a husband and wife that are chiropractors, and they had a wonderful family practice. I unfortunately had developed a very severe asthma as a child, and it was through going into their office. They had this great home office, and so I was friends with their kids. We'd go in, and they started adjusting me. And wouldn't you know, my asthma all cleared up, my allergies got better, and I learned that the body has this wisdom within, and that if you release it, your body can be healthy. And so I decided that that's what I wanted to do for other kids when I grew up. And so I went to chiropractic college and started a pediatric practice right when I was in school, and that's where I met my husband.
Yes, and I received my first adjustment when I was 18, and then occasionally I would get adjusted, and one thing led to the next. When I was going through undergrad, I ended up wanting to go to chiropractic college. And fortunately as well, when I entered outpatient clinic to start seeing patients from the community, the first family of patients I received was from a graduating chiropractor at school, graduating student, who passed his family down to me that had 3 young daughters. So that was my first real patients, and I enjoyed so much taking care of kids that it just started to grow from there, and I had the largest pediatric practice in the school at the time.
So when we opened our doors up here in New Jersey, we decided that that's what we wanted to do, was get that word out to the community of how important it is for all children, pregnant moms, postpartum, for maximizing your health potential. And in order to do that, you need a healthy spine and nervous system. And chiropractic is the vehicle to make sure that that happens.
And something that I've always known about your education processes for chiropractors has been around how important it is to educate moms about having their newborns checked after they're born, regardless if they're having any problems or symptoms. And before we got on the call, you had shared a story that just happened 2 nights ago about you going to the hospital to check a newborn. Can you share that story with us?
Yes, we received a referral from a big doula group in the area that the baby was in a breech position with only a week left to go before their due date. So we got to see the pregnant mom a couple of times, and then she ended up going to the hospital to give birth. And because she knew how important it was to our education, the next day she called us right away and asked us to come to the hospital to adjust the baby. And my wife went ahead and evaluated the baby and gave her first adjustment. And that is the greatest gift you can give a baby at birth, is a nervous system free of interference, so they could grow and develop to reach their potential on every level of their existence. And many parents who aren't educated are concerned about the safety of chiropractic care for their newborn. And even if they don't express it to you, many of them are very concerned. They've never seen a baby adjusted. They picture it as you're adjusting an adult. They don't know why the baby should be adjusted. So many of them shy away from it. So it's very important to share with them how safe it is. And there's several ways that you can communicate how safe it is to the mom, how safe it is for their baby to get adjusted. One is, if you look at malpractice rates, we as chiropractors pay a fraction of what medical doctors and pediatricians pay for their malpractice rates, because what we do is very safe. And also, if you look at the amount of force used in an average birth process, there could be upwards of 20 or 40 pounds of torsion and traction on a newborn's neck. And that's a newborn's neck that doesn't even have the musculature to hold their head up. And a lot of time it's uncontrolled torsion and traction, because they have to do what they have to do to get the baby out. And there's a lot of stress and trauma to that newborn's neck. There could be sprains and strains. If it's a more difficult birth, such as a forceps or a vacuum extraction, that force can go up much higher. And also a C-section causes a lot of stress and trauma to the newborn spine as well. So when you compare the amount of force used in the birth process to the amount of pressure used in the baby's first adjustment, there's no comparison. When we evaluate and adjust a newborn baby, we're giving the baby an adjustment with just a little bit of pressure. The way I like to convey that is if you take your finger and you put it on your eyelid over your eyeball and just put a little pressure on it till you feel it, that's about the amount of pressure that you're using to adjust a baby. It's less than a pound, and it's directed in the right place at the right time. And if you compare, if the baby got born, he can safely get adjusted. So what we like to do is share with the parents that you shouldn't have any concern or anxiety about getting the baby adjusted. You should have fear and anxiety if your baby doesn't get adjusted, because you're leaving the nerve interference in that baby's spine that will compromise that baby's ability to be well for the rest of their lives. So it's essential that all newborns get their, all new moms get their babies adjusted as soon as they can after birth.
And it's something that we're starting to see here at the Cap Wellness Center, that moms that have been getting adjusted all the way throughout their pregnancy, they're leaving the hospital, and on their drive home, they're bringing their baby in to get checked before they even go home for the first time. It's just, it's amazing gift, as you said, that any parent can give their child, for them to start off life knowing they're in alignment, that their nervous system only knows clarity and only knows health, rather than something that might be left there, maybe silent, that snowballs up months or even years later, and it's a harder process to unwind.
Yeah, absolutely, Jay. I'd have to say, on a personal note, we did this with our own family as well. We have 3 beautiful children, and each one of them, after I gave birth, while the umbilical cord was still attached, to Stu, checked them and adjusted them. So they got checked right away, because you have to think, and moms that are listening, if you've had babies in the past, you know that you go through a lot in labor. And the labor just doesn't only occur to the mom, it occurs with the baby as well. So everything that mom's going through, you're going through, that baby's feeling and expressing when they emerge into the world. So if you had a long, tiring delivery and you went through a lot of contractions, that baby went through them with you. If you went through C-section, so did the baby. And we want to make sure that whatever stress occurred to the nervous system can get corrected easily and quickly, immediately, as soon as possible, because then it's the easiest to correct. You know, so often moms will come in with children that are a little bit older, and they might be having trouble nursing, latching on, and the baby's not able to rotate their head as far from one side to the other, or they come in with torticollis, or they come in with ear infections and things that happen to them along the way. And so if we are able to take care of it immediately, the sooner the better. I actually, in practice, I've been, along with being a chiropractor, I've been a La Leche League member for, feels like forever, since I started practice, I guess. And then as a leader for almost 10 years now. And for any of the moms listening, La Leche League is a breastfeeding support, international breastfeeding support and education organization. And so we do free monthly meetings at the office, which we've held here for 15 years. And really try to reach out to that community. It's so important. And so when the other day we went to the hospital to see the little baby that my husband was just talking about, I started to assess the baby, and then started to talk to the mom about her nursing and how the nursing was going. And she was having a little bit of trouble with that. So what was happening was that the baby was able to turn its neck further to one side than the other side. And this can commonly happen, especially if there's a difficult birth, if they were in any kind of breech presentation, transverse lie presentation, any abnormal presentation during the birth process. And so this particular baby had been a footling breech for the past few months prior to delivery. And so we had a little bit to combat there. And so with the nursing, she was latching real well onto one side, not as well onto the other side. And so I was giving mom tips about how to make that happen better. We got the baby on. But most importantly is getting that subluxation, that nerve interference, misalignment in her neck corrected in order to facilitate and allow her to be able to rotate her head from one side to the other equally. And so I ended up adjusting the baby and got the baby latched on, left the mom after she had a nursing session, and we said goodbye. And it was really actually nice because she has been checking in with me, and she sent me a beautiful picture, a text with a beautiful picture of me checking this gorgeous little baby, 1-day-old baby. And she said, just as an example, she said, I just wanted to say a quick thank you for your amazing work on our little one. It's made a big difference in her ability to nurse, with 3 exclamation points. We're on our way home and we'll be in touch to schedule follow-ups very soon. Have a lovely evening. And just the excitement of, and as a mom, I nurse 3 babies. Any moms that are listening that are about to or have nursed babies, you know that if the baby doesn't latch properly from one side to the other, that can cause mastitis, the breast infections, plugged ducts, all kinds of problems for the mom, as well as issues for the baby. So a simple adjustment by your chiropractor can really help not only correct the nursing issues, but later on prevent things like ear infections, which become so common from the same subluxation. So we can allow that baby to have a healthy experience from birth onward.
Right, and think of the impact that that little adjustment is doing for not only the nervous system of that little one, but then mom's going to be more likely to be able to breastfeed as long as she chooses, rather than it being such an uncomfortable or frustrating experience that she gives up. And that has an amazing impact on the child's health, as well as the bonding between the mom and the baby.
Absolutely.
Now, you had mentioned just now about that subluxation can lead into ear infections as well. Can you go into that more?
Sure, and so many other things as well. As you're probably well aware of, Dr. J, every childhood illness, pretty much with exception, has skyrocketed in the last 10 to 20 years. Asthma has doubled. There's 16 million visits made to doctors for ear infections every year. 1 in 6 children are learning delayed and learning disabled, according to the government. Depending on the statistics, 1 in 50 to 1 in 80 children are now autistic. Allergies are rampant. 10% of kids have ADHD. Our kids are getting sicker and sicker as every year goes by in this country. These statistics are shocking. They're really jarring, and including eczema and colic and reflux and on and on and on. And this is all happening under the recommendations of the pediatrician, the direct-to-consumer advertising of the pharmaceutical companies, and the culture we live in. And parents are desperately looking for better approaches and solutions for their children. And children that grow up in the chiropractic wellness lifestyle, you'd be hard-pressed to find any of them that have asthma or autism. And that is because when we start evaluating and adjusting the children early on for subluxation, removing that nerve interference, it's allowing their whole body to work better. Their immune system is stronger, their biochemistry is better, their hormones are better, their bodies heal better, and they thrive. And the most common reason children enter our office is because of what you mentioned is ear infections. And the biggest mistake that is being made now is that, the parents are accepting the recommendations to give their kids antibiotics. And if you look at every major study that's come out in the last 10 years, from the Journal of the American Medical Association, the New England Journal of Medicine, Harvard University, the federal guidelines from the Agency for Healthcare Policy and Research, and on and on and on, they all show that over 95% of ear infections in babies and children are viral. So antibiotics are not only the wrong approach, but there's a lot of negative consequences from that as well. And the children that enter our office with ear infections all resolve in a very short time. And, one of the theories is that the eustachian tube drains out through the deep cervical lymphatics, which go through the neck muscles. And when you have a subluxation in the neck, those muscles that attach to the bones become tight, and then it causes a constriction or a stasis, and you can have fluid buildup in the ear. So when we adjust the child, not only does it remove interference from the nervous system, but the muscles can relax, the fluid can drain out. And, thinking back in 22 years, we've never lost one child to a tympanoscopy, to the ear surgery where they put tubes in. In fact, we've had them scheduled a week or 2 weeks out many times when the patients come in, and every one of them has been canceled. And the ones that start from birth, they rarely ever have an ear infection at all. So chiropractic is not a treatment or a cure for ear infections, but the parents report back to us on a regular basis that their child is completely better and they don't have reoccurrences.
Right, and getting the neck muscles to relax, but then also the nervous system that controls the immune system. And the stronger the immune system is, the body can just contact what it needs to contact, build the immunity naturally, and then be able to process things out and just be healthier because of it.
Absolutely, of course. And that's why this isn't unique to ear infections, but when kids come in with all sorts of allergies and asthma and colic and all the different so common childhood conditions. Dr. Stu went through the stats just now, but it is so common. But because so many kids have nervous system dysfunction, so once we clear that up, if we look at our children, for example, they've never had an ear infection. They've never had these types of illnesses that are yet so common. And I know when we talk to other chiropractors and other patients who've had their kids under birth, they have that same experience. And yet if we look at the general population or walk into a regular classroom, we'll see that most kids do because they have nervous system interference. They have subluxation. So once we allow the body to correct that, it can flourish.
Dr. J, one of the core things we like to get across to parents is that the normal state of our children should be health. But because of the way they're being raised today in the culture with the skyrocketing childhood illness and drugs, is parents think that it's normal for their kids to be sick and on drugs. Oh, all my friends' kids are on antibiotics and the babies are taking Zantac, and they think that's just the way it is, and they don't know there's other opportunities for their children to be healthy, and there's no better way for their children to achieve optimum health and wellness than by having a nervous system free of interference so they can reach their potential in life on every level of their existence. So, the body knows what to do when it's free of nerve interference, and what it knows how to do is heal and be well and thrive. And that's our biggest message to the community, is to allow their children to be the best they can through a nervous system free of interference.
Absolutely, and really empower them, empower patients to feel confident in making those decisions. And we do live in a fast food society now where people want fast food, fast health, fast everything, and they're looking for those quick cures. And sometimes they don't necessarily want to take the advice that the old country doctor might have given them of give it a few days and just let the body heal. People used to love to take that advice, and today we want to look at these quick cures for everything. But we need to know that if we just empower the body, it'll get well. Because as Stu said, the normal state of the body should be health, and it's going to try to achieve that every time, if given the opportunity.
And if those little ones' bodies are starting off life operating so optimally, then when they do come down, say, with something, they heal so quick. And that's something I see all the time in practice as well. Like, kids heal so quickly. You just need to get those blockages out of the way. And instead of letting those things fester and kind of endure or tolerate or suffer through those things for the first couple of years so they can, quote, outgrow it, why not start them off healthy and then later on in life not have to spend all the time and effort of trying to regain your health that you could have started off life with?
That's right.
Well, another thing that you are definitely known for in the chiropractic community is your outreach to the community in a wellness basis. Not just only taking care of kids to help them with all of these different health problems, but your practice is full of kids that are coming in that are already well, and that's something that is a little different for parents. Usually they're used to taking their kids into a doctor if something's wrong, and hopefully it gets, quote, fixed. But in our practices, we have kids coming in all the time that are well. And how do you explain that to parents?
Yes, that's what we've experienced our whole practice is, patients usually do come in with some sort of challenge, but after they see the results, then they choose to continue that for the rest of their lives. And it's so important to get out into the community and share that. And
it's a matter of just simply redefining health to them and allowing people to understand that they have these opportunities. As you said, we don't want to wait until we're sick. We want to be preventative and make sure that we're staying as healthy all the time as we can. When they're making other decisions, they're maybe drinking filtered water and they're so careful about what they're putting in their body, and they're making decisions about fluoride and going to the gym and working out and all these extra little things. Should I co-sleep? Should I homeschool? And we want to make sure that proactively they're always thinking about what can I do for my spine and my nervous system to make sure that it's as healthy as it can be, because that's the foundation of all health. That's at the top of the pyramid. If you don't have a healthy nervous system, no other system in the body is going to work right, because your nervous system controls your respiratory function and controls your heart function and controls every other, your immune system, and all the systems of the body are controlled under that.
Our children have such a powerful ability to heal that we see miracles every day in our practice with children that had cerebral palsy and Tourette's syndrome and stuttering and asthma. And, it's awesome. We should acknowledge those and celebrate those cases. But one thing that's important to remember is every adjustment on a child is a miracle. Every time we remove interference and allow that child to reach the optimum genetic potential on every level of their existence is really a miracle. And what's really a miracle is all the children that continue to get adjusted on wellness care that don't have any symptoms, that continue to thrive and to be able to excel in all areas of their life. So those are the real miracles that we see. And, one of the things that we do in our practice, which is a little unique, is, my wife has always lectured and spoken on the platforms about developing a family practice. And many people think of that as a, mom and dad or 2 or 3 kids. But a family practice is really when your whole practice becomes a big family, and all the parents see how the other families are living the chiropractic wellness lifestyle. And it's just part of what they do is they eat well, they exercise, they want to, get a good night's sleep. And part of that, and the most important part, is to get adjusted so they have a nervous system that's free of interference. So parents not only see the results in their own family, but they see the results in all the other families in the community, and that really gives them and us a lot of credibility. And the bottom line is results. It doesn't really matter what we say. It doesn't matter what the medical doctors say. It doesn't matter what the media says. What matters is, are these kids and these families in front of us healthier now since they've been getting adjusted than they were before? And they see that, and it becomes very powerful.
And then once they do have those results, as you were saying about community, these parents want to hang around the other parents that are doing the same, to have kind of birds of a feather flock together. And the more we can create healthy communities, that will ripple out to make impacts in, other families that might not be as healthy, but can be, and they can help spread the word as well.
Yes, and we have lots of platforms and opportunities for those families to get together. A lot of people that come to our practice, they all know each other in some way or another, from their kids' activities to the beach to where they work. And so, there's a lot of camaraderie between our patients. They almost think like they're going to like the water cooler, or the community diner where all the conversation takes place. But we also have a international program called Wellness Moms America International, where the moms come on a monthly basis and learn about the chiropractic wellness lifestyle and support each other. They come to our Kids Day America International programs around the world to learn about health, safety, and environmental awareness. They go to our Children's Wellness Expo. So we give them the areas that they could be part of it, volunteer, support each other, because we're living in a medically driven pharmaceutical world where every third commercial on TVs take this drug, and medical doctors tell them certain things, and there's a whole culture of growing up in the medicine cabinet. So the kids grow up with playing with the doctor's bag and giving each other fake shots and drugs. We want to create an environment where they grow up in the wellness lifestyle and they're empowered and they don't fear germs, and they learn about the inside-out approach and innate healing, and they want to get adjusted because they know that their power's on and they can do all the things they want to do. So we create a whole environment and culture that they can grow up in that, and they'll be the teachers, leaders, and preachers of tomorrow.
And a funny story along the lines of that is there was a family that came in to the 3 kids, and the mom got adjusted for the first time. And I, in practice, use an activator, a little handheld clicking instrument to do adjustments on little ones. And later that day, the mom sent me a picture of the oldest kid took one of those toy syringes that are in that doctor's bag that you just said about giving shots. And she had her little brother laying down on the bed, and she was using it as an activator, adjusting the baby. I'm like, all right, that's a better use of that tool for sure.
That's fantastic. I love that. They come in with all the stories. Kids will bring their teddy bears and their favorite dolls in, and we encourage them to do that, and they show us how they adjust them, and the moms will tell us stories about how they were doing that at home or how they were nursing their dolls and following in the mom's footsteps that way. And it's just so wonderful to see them growing up with a healthy mindset, and with that in their forefront of their mind, as opposed to running to the medicine cabinet. For the moms listening, sometimes you may feel, you may just be venturing into the world of wellness, and you may be thinking, gosh, are my friends going to look at me strangely when I think I might want to use a midwife instead of the obstetrician, or they might think it's strange that I'm considering maybe homeschooling my kids, or maybe I want to hold off on vaccinating or selectively vaccinate or do different things, and maybe I don't want to drink fluoridated water. It could be anything, and they think all these things, and you think if you do one of these, oh my gosh, they're going to look at me strangely. And what we try to do is foster a community where moms can come in and they might feel like, oh, should I dip my foot in the water? And all of a sudden they realize the water is warm. Dive in. And they become a leader, and they feel comfortable and realizing, oh my gosh, other mom, you think that way too? And you think that way too? Oh, let's talk about this. Let's talk about that. And they get a forum for being able to discuss all these ideas that, gosh, they thought they were the only one that was questioning, should I really give that antibiotic? Should I not? Should I wait? This is what all moms are thinking about. And so we want to be able to have that community for you where you feel really comfortable discussing it and making an empowered healthcare decision, what's right for you and your family, because you found out that that's right, and not because you felt pressured into making a decision and regretted it later on. So that's what it's all about, is just, making sure that we're empowering healthy decisions.
And that's what we're really trying to do here at the CAP Wellness Center as well. One, this podcast is an audio library for, parents to just get empowered with more information. But then also within the center, we've do a lot of birth education to have a woman be much more empowered going into their pregnancy and birth. But we're also finding now that we have a lot of support groups we're starting up as well for, just as you said, where there's a postpartum group that's led by a psychologist here. We have a breastfeeding support group each week. I'm going to be leading a children's health workshop starting in a couple of months here as well. And I want to also wrap up with, in the last couple of minutes, is you have tremendous resources online as well for if, they're not local to where you are in New Jersey or here in San Diego, they can get more information about what we talked. Could you share with our listeners those resources?
Sure. They could reach us at doctorswarner.com. That's DRSWARNER.com, doctorswarner.com. And that will be a whole resource center for parents who want to raise their children in the chiropractic wellness lifestyle and learn about all the reasons why their children should be adjusted and all the benefits and related issues.
Fantastic. And I'll put that link in our show notes here in iTunes, but then also on the blog post there, so people can click right into it. So, with the last couple minutes here, I always like to wrap up our podcast interviews with our experts with two questions, one for the moms and one for the babies. And the first one is for those moms that are listening right now. Either they're moms-to-be, they're pregnant, waiting to meet their little one, or they just had their baby and they've got little ones running around. What's the main message or the main point you'd like them to take to heart right now?
Well, CAP Wellness Center and Dr. J have a national reputation for excellence. And, I wish we had a CAP Wellness Center here on our East Coast where we could send moms to. I'm not sure if there's any plans to expand outside of San Diego area, but the moms really need to find a sanctuary and a resource to empower them to have the birth experience that they want and be able to have the education and resources so their children can grow up in the chiropractic wellness lifestyle and be healthy. So, the residents of your region are so fortunate that the moms can come to your center and get all those resources and experts.
Well, thank you for that. We do have plans to expand out of San Diego, but that is a couple years down the line, but look for that as well. And then the last question I have is for the little babies, either a baby that's just born and might be listening to this podcast with sitting with mom or dad, or maybe even in utero, they're not even born yet. If you could whisper one thing into their ear, one message, one piece of wisdom into that little baby ear, what would that be?
I'd say enter the world bold and fearless, and know that God gave you all the wisdom and intelligence within you to live life to the fullest. And trust your parents and trust your innate that God put within you, because that will allow you to have a phenomenal life. And we thank you so much, Jay, for getting these words out to so many moms and being able to help them so much along to have a healthy birth and a really successful parenting experience.
And thank you, Dr. Stu, Dr. Terry. I've been a huge fan of yours since I started my chiropractic career back in 1996. I've followed your work, and you've really had an impact on me as a chiropractor that is allowing me to do what I do here in the CAP Wellness Center. So I just wanted to take that moment to share that appreciation for you, and then also for you taking the time today to share your wisdom with our listeners here. It's been an amazing conversation. There's so many resources here, and I just really encourage the parents listening to reach out to the doctorswarner.com website, get more information, ask us here at the podcast about it, and just get empowered and allow your babies to be super healthy as they're designed to be.
Absolutely. I think that putting together your birth team and your birth plan is such an important thing. And it seems like you guys facilitate that so well for moms and allow them to have so many opportunities. And I'm a strong believer in you are your peer group. And so by allowing them and moms out there to take advantage of everything that the CAP Wellness Center has to offer, and putting together that awesome birth team to have the birth experience of your dreams and thereafter.
Thanks, Dr. J.
Thank you very much. I really appreciate your time, and hopefully we can talk again soon.
All right. Thanks, Dr. J, so much.
All right.
Thank you for joining us today. For more information about this episode and other natural childbirth and parenting topics, please visit us at capwellnesscenter.com or message us on our Facebook page with any questions you might have. We here at the CAP Wellness Center look forward to helping you and your family be as happy and healthy as you can be.